Okay, so I hope that everybody who wanted to join in are already here. And if somebody is late, they can catch up and see what's going on in our presentations. My name is Vesna Aleksovska. I'm the chair of the International Gaucher Alliance. And today we are here to hear a lot of experience, a lot of best practice from two ladies who are very experienced and who know how to fight the institutions in their countries. I loved both of them, and I'm happy that I had the opportunity in my life to meet such people as Fernanda and Kate, and I'm very happy that they agreed to talk today about home infusion, enzyme replacement therapy. We all want it in a way. We are all fighting in our countries to manage to get ERT at home for our Gaucher patients, especially in a situation like we have now with the COVID-19. And I know we are scared and isolated and sometimes lonely, but we are together, and together we are stronger. We are rare, but we are not alone. So this is why we are sharing experience, so we can see what to do in our countries and how to fight for our patients, and how can we do more for our families, our Gaucher families, our Gaucher community. Without further talking from me, I would like to present some pictures that you've seen on my screen. Am I sharing my screen? Do you see them? Okay, great. So these are pictures from Italy that Fernanda sent to me so I can share them. The families agreed to share these pictures. They show how happy the children are having their therapy at home and not in the hospital. I have to say, as a patient myself, it's very nice to have the treatment at home and not in the hospital, because the hospital is always scary. No matter how times you go there, no matter how many people you know over there, at the end, it is still a scary place, because that is the place where you go when you are sick, and at home you are healthy, a healthy, normal person. So, Fernanda, I'm inviting you to start with your presentation about home therapy in Italy. Can you share your screen, Fernanda, or do you need help? I'm not hearing you. You need to unmute yourself. Uh, Tanya, can we unmute Fernanda?
I have unmuted her.
Yeah? Okay, I see mute on my...
Yeah. Okay.
I will stop sharing so she can share.
She needs to unmute herself.
Yeah. Fernanda, can you... There is a button on the left corner, says unmute. Right corner, I'm sorry. When you press on your picture that you see on the screen, or down on the left corner.
That's working all right. But her microphone is up to the ceiling. So microphone should be downwards.
Okay. Fernanda, can you speak? No, we are not hearing you, unfortunately. Your microphone from your headphones, to put it down because it's up.
Can you?
Aha, I hear you.
Now can you hear me?
Yes.
No.
Yes, yes.
You can hear me. I can talk.
Yes.
Okay, okay. Okay, I'll start. Before starting, I just have to explain a few things. Unfortunately, in Italy, we no longer have the state public hospital. I mean, the public hospitals, we have them, but they've all been passed on to the regions, which was a very bad choice because the public health system being put in the hands of 21 regions means that you have some patients who are class A patients, class B, class C, and even worse, class F. This is a big, big mistake, and the COVID proved it, even though we knew before. And secondly, home therapy started in Italy more than 10 years ago, and it was started thanks to a private company and with the collaboration of a doctor who was dealing with Fabry patients. And together they organized the system of how it should be. So, having said this, not all 21 regions in Italy will allow home therapy. And we have only 2 regions that have actually deliberated home therapy, legally deliberated it, and that is Venice and Lazio. All the other regions that allow home therapy allow it just to be nice. I mean, they allow it, but they haven't made it official. Okay, so for many years, associations like ours have been fighting to allow lysosomal patients to have access to home therapy. Not all patients are allowed to do home therapy, and many are forced to go to the hospitals or the reference centers. We have asked other lysosomal patient associations to join up with us to work together, and we have continuously conducted communications and awareness campaigns to support the rights of our patients to receive home therapy, contacting both the press and the institutions. When in the first few days of March, the health situation in Italy seriously deteriorated and our country decreed the lockdown, our first thought went to all the patients who need life-saving therapies and who must go periodically to the hospitals to get them. Our main objectives were right from the start the safety of the patients and family members by avoiding non-essential movements to hospitals where there were a lot of COVID-19 patients hospitalized, and they kept getting bigger and bigger and bigger. At the same time, we had to prevent patients from stopping life-saving treatments because they were afraid of getting an infection. Now, during our strategy to overcome this, during these first 2 months of the health emergency, it was essential to relate to all the actors in the health world, starting from the institutions, to which we sent many letters signed by dozens and dozens of Italian associations, up to the individual reference clinicians in the territories that have helped us manage the most specific regional situations. Our association, together with the Fabry Association and the Italian Pumps Association, we got together, we wrote a letter to the Minister of Health, and we also wrote to the presidents of the regions and to the regional health departments, as well as to other institutions in charge to raise awareness of the needs of patients with lysosomal diseases at this time of emergency from COVID-19, with a particular attention to the administration of ERT at home. Furthermore, we joined dozens of associations that signed an open letter to the government promoted by the Italian Federation of Rare Diseases on the issues of disability and rare diseases in times of COVID-19. Particular attention in this document has been given towards home therapy. We requested that home therapy be allowed wherever possible in order to avoid unnecessary trips to hospitals. And if that wasn't possible, we requested that the hospitals create special corridors that would be safe and far away from any risk of infection. This here. Okay. We also managed, and this is really a big breakthrough, because we have been fighting for years to get home treatment in Tuscany. On March 27th, it was decided that patients with Gaucher disease being treated by Dr. Linari will be able to switch from hospital infusions to home therapy. And the request itself could be made by sending an email without having to go to the hospital. And also, for those patients doing the oral treatment, they no longer need to go to the hospital pharmacy to pick up the pills. They will be delivered to their house directly. This is the result of the insistence of our association and the collaboration between Dr. Linari, who's also one of the members of our medical board, and she's in charge of the reference center for the adult Gaucher patients in Careggi Hospital in Florence. And together with Dr. Marinai, who's director of the Citizenship Rights and Social Cohesion for Drug Policies and Devices, and Dr. Cecilia Berni, they agreed to this, and we even asked, do we have to wait for a special determination, a legal thing or something? And they said, no, you start immediately with home therapy, and they started immediately. The patients in Milan, instead, in Lombardia, it was already possible for patients to do home therapy if they wanted to, although not all patients were accepted for home therapy by the local health authorities within the region, Lombardia. But in Milan, special efforts were made to switch all the patients who were going to the Policlinico in Milan, to switch all of them to home therapy, not only Gaucher patients, but patients who need blood transfusions regularly, cancer patients. All of these patients were all sent home for treatment, and these wards were all turned into COVID-19 wards for the sick, for the infected people. So this was very good. We also had asked our doctors of our medical board to write a recommendation or something, and they did, and it was necessary because doctors were realizing that a lot of patients were not doing treatment. They were afraid to go to the hospitals. They were stopping treatment on their own, and it was necessary to avoid getting them infected both during the trip to the hospital, during the stay, during the infusion time, and because of this, as I said, a lot of patients stop treatment. And this is why our scientific community immediately pronounced this, that it is the opinion of the scientific committee of the Italian Gaucher Association that the patient in enzyme replacement therapy must continue treatment during the COVID-19 emergency and follow all the procedures recommended by the national and international health authorities to avoid infection before, during, and after the infusion, wherever this is held. Between the real risk of stopping, even for short periods, of therapy, which has proven effective in preventing the development of acute and chronic disease damage related to Gaucher disease, and the hypothetical risk of contracting infection, potentially harmful to the patient's health, the committee strongly suggests continuing the enzyme replacement therapy, using all the protections and precautions necessary for the prevention and containment of the infection. At the same time, on March 30th, the Italian Drug Agency, IFA, published a determination concerning containing the exceptional recommendation for the home administration of drugs for enzyme replacement therapy. This concerns many diseases, not just Gaucher. And of course, concerning Gaucher, the idea is to bear in mind that the competence The final decision belongs to the region. The Italian Drug Agency recommendation includes some of the main indications that had already been made in the document we have for regional health use, and it's aimed at protecting the safety of the patients. Therefore, in order to be able to apply for home therapy, the patient has to be stable. He has to be on having been. He has to have done therapy for some time, and the specialist must agree to it. And this can also be another problem. But the infusion must take place while the specialist of the reference center in charge of the treatment is available. He has to be available by phone. There are other things said, but at this point, we understand that IFA would like to extend this even beyond the COVID. In other words, I think that maybe IFA, the Italian Drug Agency, will give us a hand to make sure that home therapy is available throughout the whole Italian territory for those patients who would like to do it. Basically, this is it. But then, I mean, don't forget, we've been fighting for years. I fought for each individual patient. The little girl you saw there, I fought for her to get treatment. Almost all of them, singly. I've had to write letters and request it and explain why and so on and so forth. It usually works. There are two regions who are very, very much against, and they are the Piemonte region and the Emilia-Romagna region. They just don't want to have anything to do with home therapy. Now, the doctors cannot, I mean, the hospitals don't have the money to send nurses at home for home treatment, but at the same time, they don't like having private treatment. So it's still a battle, you see. This is the problem. There are a lot of patients doing home therapy now. Thank you.
Okay, thank you, Fernanda, for sharing this. Now, I know that you probably have questions. It will be good if you can write these questions down. You can do it in the group chat or directly to me or Tanya to send the questions, and then we can ask them. First, I would like to hear Kate from Greece also, and then we are going to do questions and answers session, if that is okay with all of you. So, Kate, can you share your experience with the home treatment infusion and how you try to get this in your country?
Thank you for this initiative, to take this initiative and to have this web meeting, which is very important for all of us, and I think it's going to be very fruitful. Well, what's home treatment? Home treatment is to have another treatment option. So this, I think this is challenging both for in the care, both of the Gaucher patients and lysosomal patients, because we are a lysosomal association. But it's also a challenge for the health authorities. It's a challenge for primary care, because I think primary care should be the authority that should handle this home treatment. But in Greece, we don't have, we haven't organized yet primary health. And it's also a challenge for hospitals and for regional health authorities. And generally, I think now it's also a challenge for the centers of expertise. Where in Greece, there are 18 centers of expertise for rare diseases, and we have the first Gaucher Center of Expertise. I think they will have to organize this home treatment in Greece, but I'm telling you some of the challenges now the patients have. We have patients, young patients, who have professional problems. They want to follow their careers. We have older patients, Gaucher patients. Now, we started therapy, for example, when we were 35. Now we're 55, we're 60. We have more health conditions, more chronic health conditions, and mental conditions. Moreover, we got, as a lysosomal association, people who have respiratory problems, cardiac problems, mental problems, and I think it's not only coronavirus period now, but I think it's a very, how can I say, it's a health risk for most of us to go to hospitals even in normal conditions, because of many hospital virus exists. So many parents of Gaucher and other lysosomes, and many patients during the when there is the winter period, we are very afraid even then to go to hospitals. In the past, I think Anna Greta remember that we had a workshop, I think 15 years ago in Greece, about home therapy and how effective it can be. And Greta brought us some good practice from Denmark then. But for many years, there was a talk between patients, and Gaucher patients mainly. They were very concerned because they had doubts, because it was unknown to them. Home therapy, it was unknown to them. But it was also because of the poor condition of the health system in Greece. And they were afraid of side effects and what would happen because we don't have good emergency departments. Things don't go very quickly in the emergency departments, even intensive care units and other things. So they were afraid of that. And that's why we didn't took more initiatives for home therapy. And as well as there were the doctors that had the same doubts as patients because of the poor health system in Greece. But also the health authorities were very concerned because they just told us, even 3 years ago when we went again for home therapy, they told us that they were concerned because of the high cost of the drug and because of many problems that they had with pharma industries and many frauds that were happening in Greece. They were afraid to have home therapy, even though we know that therapy for Gaucher patients and lysosomal is personalized. So there wouldn't be any problem with that. Now, in the beginning of this period of the coronavirus period, our board took immediate action and lobbied about our access to treatment. It wasn't in the beginning. It wasn't about home treatment, but we thought, how could we access hospital for treatment? So what we did, we saw it as an opportunity to raise this problem and to put it in the center of attention of the health authorities. So what many patients, due to they had the temptation, they didn't want to go to hospitals, they were afraid to go to hospitals, they were afraid to commute, to go to hospitals, even with taxis, not to talk about, the subway or that, they wouldn't even think of that, and they were afraid of contamination, even from the nurses, even of the health professionals that they would go there. And of course, many of our patients have stopped their monitoring, and many patients all of the patients don't have any physiotherapies. So this is also a big problem. So what we did was, the first thing we did was, we wrote a letter as a board, we wrote a letter to the Ministry of Health, but in this letter, we also gave them some suggestions how to go on with home therapy, not just to appeal for home therapy, but we gave some suggestions. We gave them our experience from the IGA and from all other countries that have this, and we proposed to them to help them if they want to go on with home therapy. And then we sent a letter to all the directors of the hospitals so they know what was the problem. The Greek Organization of Public Health, the Red Cross, because the president of the Red Cross was also the president of the Rare Disease Scientific Society in Greece before. And of course, we wrote letters to our doctors, and we want them to really say yes to this, because long ago, they used to say, no, we don't want home therapy. We don't want to do that. We are afraid to do it. But now, we are very grateful that all our doctors answered that, yes, I think the coronavirus is an opportunity. We agree with you, and let's go for it. and through our hospitals and through the centers of expertise. But we also thought, how can we do this? I mean, all right, we wrote a letter to the Minister of Health. What can we do to go on this moving? So we also wrote a letter and we communicated with the doctors that are in the Ministry of Health. We have a rare disease committee in the Ministry of Health. And I think half of the doctors are doctors that have lysosomal patients. So we're very lucky about this. So, and we also, you know, there is the Society of the Metabolic Diseases in Greece, and you know, all know Dr. Michalakakis. He was also the vice president of EWGGT. So we also ask a letter for their help too, her help too. She's also in the Rare Disease Committee in the Ministry of Health. So what she did, she thought that would help us was to write a letter of recommendation from their society, and the letter of they agreed that we should go on with home therapy, and they said that the implementation of home therapy is very significant and has positive effects on the patient's quality of life. They said they have some questions about the administration of home treatment. They also pointed out that there should be criteria for patients that will be having home treatment, because not every patient can have home therapy. And also the need of education of nurses, to have experienced nurses, to have nurses that have knowledge of the diseases and how to monitor the disease. And they also pointed out that there should have knowledge of side effects, of recovery if something very bad happens to patients. And of course, the suggestions of Dr. Michalakakis is that home treatment should be applied by the health authorities, but if there was support from pharma industry, then they should be in very good collaboration with our patient associations and have transparent procedures to do this. So, now the Committee of Rare Diseases, as we were told, last week they had a web meeting, and also in the web meeting, except from the doctors, there was also the Rare Disease Organization of Greece also attended, and we are waiting for the suggestions too. And as we already have the support of our doctors, I think that this is a way that we can move things forward. Except all of these, we also sent an application, an appeal to the Red Cross to offer us transportation for our very severe patients. So at the moment, the Red Cross is transporting most of the severe patients to hospitals. And now we have reached an agreement with all three pharma industries that if there is legislation for home therapy, all of them, Shire Takeda, Genzyme, Sanofi Genzyme, and BioMarie, can offer us home treatment through their patient support groups. Moreover, Genzyme, Sanofi now is they're just finishing the procedures, and they are offering us a permanent transportation for very severe patients, and they also offer us transportation of drugs, because we have some problems with hospitals that the pharmacists don't have, the hospitals don't have the budgets. So we have to go to central pharmacies. So they are also, they're going to transport drugs to 2 main hospitals in Athens. This is going to be a pilot program for the region of Attica, which is all around Athens. And also Takeda Shire has offered us to take some patients to private hospitals if they cannot do this in their own hospitals, because some hospitals are coronavirus centers. And of course, at the moment, we're waiting for the support programs to go on. I think we have made a lot of lobbying. We are going to go on more lobbying with some also heads of the new centers of expertise for rare diseases. And I think we can have more ideas from you, what you did in your countries, so we can go on with this. Thank you.
Thank you, Kate. That's great. You and Fernanda have done so much in your country. It's amazing how you find the strength to talk to all the institutions and fight with the administration, because it's not easy. I know that. I'm from North Macedonia. It's even worse here. It's very difficult to make doctors and institutions hear the patients. So I see here in the group chat there are a lot of questions or requests of some kind. So Fernanda, they want people want to know if they can have a copy of the exceptional of the document with exceptional criteria about home infusion. And Kate, they also want to see what kind of document do you have in Greece. So anything that we can share, we will share with all participants, with all our member organizations, and everybody will get the information about how these documents are made. I also saw that Shomrat from Israel offered to share some documents on home infusion about some experience of what that means and how it works. So I would like now to ask if some of you wants to share their own experience or ask a question to Fernanda, Kate, or somebody else. If you raise a hand, or maybe I will see you, or unmute yourself and start talking. So I have Raja raising a hand. Okay. Raja, you can speak now.
Are you able to hear my voice?
Yes.
Okay, thank you. Good evening to everybody. Is it home infusion? Is it okay for this taking the capsule in oral format? Hello.
Hello.
Is it okay for taking this capsule form in this for this Gaucher home infusion?
I'm sorry, I don't understand the question.
Do you mean to change
instead of taking this enzyme replacement through vein, you know, for this going to this time to go to hospital, and this now the coronavirus this is very dangerous in our country. Is it okay of consuming this capsule in oral?
Aha, you mean for patients to go to oral therapy?
Yeah,
okay,
that's what I'm
oral
asking,
therapy is not available everywhere. It's available in some countries, some it's not. And also, not all patients, not all Gaucher patients can actually take this pill. There are some patients who have to stay on enzyme replacement therapy, and they cannot take the pill. Also, the pill has some contraindications with some drugs. So this is why, and it's not safe for pregnancy yet, or for breastfeeding.
Ma'am, my son is Akash. She's age 19 years old.
Okay.
Is it okay of taking a capsule? Is it okay, ma'am?
Yes, it is. I'm on the pill also. I feel fine. It's
Can I just
Okay,
add
thank
that,
you.
can I just add that one of the important things that Vesna did say is that obviously
Yeah.
the oral therapy is licensed for adults,
Yeah,
but it is not.
I'm in Chennai, in this part of India.
Yeah. So my understanding, particularly in India, is there are
Yeah.
some patients that are on the oral therapy, but they
Yeah.
are on oral therapy as an extension of the original
Yeah,
clinical
oral
trial.
therapy is having this Shashank and two
Yes.
guys are getting this.
Yeah. Yeah. However, for new
Yeah.
patients, at the moment, there is not the opportunity for new patients to switch to the oral therapy in India.
It's-
There's also
Oh.
another problem, if I can say so, Tanya, with the oral treatment, especially during the COVID, because if by some horrible mistake you come down with the infection and you're taking the oral treatment, you have to stop it immediately because the two drugs do not work well together, and it can be very dangerous for a Gaucher patient to continue oral therapy if he's infected with COVID-19. So I wouldn't even start at the moment any oral treatment.
Yeah.
In this moment.
Yeah, and actually, just to add to that, the IGA together with the European Hematology Association will be sending out a fact sheet next week to everybody, and that particular area is on that fact sheet, Fernanda. So we'll be sharing that. So there are some challenges with some of the medication if you do contract COVID, and therefore obviously you would have to do everything in liaising with your clinical
Thank you.
Gaucher clinic.
Thank you, ma'am. Thank you.
Okay. In the group chat, there are a lot of messages. So if I don't read somebody's question, please, raise a hand and ask the question yourself, so we are sure that everybody is heard. We've had some conversations from Patricia and from Paulina, and okay, it's about home therapy and misuse of drugs or vials. So we have to understand that not all the countries are same. We have countries in development, countries that are not even on the road to development, and we have developed countries. And in some poor countries, uh, some patients sell drugs on the streets, which is, for some people that would be crazy to even think about. I mean, I would never give my drugs to anyone else, but in some countries this happens, especially in cancer patients and oncology treatments and stuff like that. It's very scary, and there is also falsified drugs and a lot of other problems and issues. But today we are here to talk about home treatment and enzyme replacement therapy at home. So I would like to stay focused on this subject if possible. This would be great. Somebody asked if we can share EWGGD recommendations. I don't know if you remember that we had, there was a webinar from the EWGGD about Gaucher and COVID-19 situation, and they said a lot of things about treatment and COVID-19 situation and about home treatment. And some of these recommendations we already implemented in our letter that we prepared to send to member organizations who ask for support from IGA for enzyme replacement therapy at home. So probably all of you already have this letter because it was sent together with the link and invitation for this meeting. If you need such letter from the IGA, we will provide it. It's not a problem. Because we are here to support our members, of course. Okay, Shomrat, you want to share something? Can you unmute yourself and share?
Yeah, hi everybody. So glad to see the really beloved faces, Fern, everybody. So greetings from Israel. There is a new issue. We have over 96%, I think this is the exact number, of patients being treated at home for many years. However, during the COVID period now, there is another concern. I have to raise it. We're facing this right now, that we have the same nurses, trained nurses, going from for the same patients, the same families for years. They are really actually part of the families now. However, their daily travel are from home to home, and several patients showed concerns regarding contamination between the home therapies. The same nurse going from home to home and might be exposed to COVID-19. And there were some cases that patients canceled their home treatments due to concerns, these concerns. The teams, the treating teams are really trying to be cautious, wearing all the needed recommendations for the masks and the heads and the gloves and everything. But I just want to raise this concern that even at home therapy, things might be a bit dangerous. We are facing these cases. I think none of the patients are being treated at hospitals now, none of them in Israel, as far as I know. There are really few self-treated families. I mean, the patients are treating themselves or father to sons. None are being treated in hospital these days, but there are some who chose to discontinue their home treatments due to these concerns. So I just wanted to raise this issue now.
Yeah, I completely understand the issue. I mean, it's scary. It's not easy at all. And I mean, I know in Macedonia, they've stopped treatment for a while, the ERT in the hospital for the patients. So they just called them and said to them, don't come to the hospital anymore, take a break from your therapy. So I was angry about this, and I've talked to the hospital, and all of our patients are at the hematology clinic. So now they've made a special room, and there are nurses who treat oncology patients and Gaucher patients at the hematology department. So they've made this, special room. They measure your temperature before you get in to get your therapy, and it's really a nice thing to do for the patients, to separate them from all the other patients who come to the hospital for controls or for tests or for analysis or for whatever else. So this is only for people who come for therapy to get some kind of infusion. So all of these are vulnerable patients, and they all take good care of themselves, because the recommendations are that none of them go to work, and even some of their families are released from work. So the patients are protected in the real sense of the word, and this is good because the fear is less than it was before. so we need to actually work together, patients and doctors and institutions, to make a safe place for the patients, definitely. Regarding DWGGD, as you all write, we want DWGGD recommendations. Tanya and I will talk to them and see if there is possible to get something in writing from EWGGD regarding home therapy, because they already wrote something about the coronavirus and Gaucher disease. So this would be something additionally. As I remember in the previous letter that they wrote, there was a sentence saying that they not prefer, but they recommend home therapy instead of going to hospital for better protection of the patients. Of course, here we need to make sure that the hospitals provide nurses who are not in contact with coronavirus patients, which is the scary part of all of this. So now I will leave for Tanya to say something, and everyone else, if anybody has a question, please raise a hand or say something. Okay, Tanya?
Yeah, thanks, Vesna. I just wanted to say a few words about what happens in the UK. We are very similar to Israel. So I would say 99% of our patients receive home therapy. And we have different levels of home therapy in the UK. So we have patients that are fully dependent. That means the nurse goes in, they make the drugs up, they cannulate, they stay the whole time, and then they take the cannula out, or portacath. Then we have semi-independent, where the nurses will go in, they will help the patient do the drug, they will cannulate, and then they will leave, and then the patient will take the cannula out afterwards. And then we have totally independent patients, where either the patient does their own treatment or their carer. And what our service, which is supported by the National Health Service in England, does, is they actually, part of the home care service is actually to train caregivers and patients to do their own treatment. So we've had similar issues in the UK, where some of our families haven't wanted the home care nurses to go into their homes, and that's been their decision, and they've discussed that with their clinician. But where a lot of our patients have benefited, where they do their own treatment, and many patients have been doing this for 10 plus years, they've had no disruption in their treatment, because their treatment is delivered straight to their front door. They then take it in, they store it, and then they do their own treatment. Obviously, for home care nurses going in either for fully dependent or semi-dependent patients, they have full PPE equipment, and I know that was one of the questions that we had previously. And we, I don't know if Shomrat has this in her SOPs that she discussed on the chat, but certainly that's something I could maybe look into and see if I can get some of the specifications off of our services. So home care is fantastic, but as Shomrat says, there can also be some challenges. However, at least that's the patient's decision with their clinician, whether or not they want to take the risk of not having their treatment, but by protecting themselves.
We don't have nurses from the hospitals coming through home treatment. So what happens is we have private agencies, there are 2 of them, and they are only dedicated to the patients who do home therapy. I mean, they don't work in the hospital and then they go to the patient's home. And they also are very careful about protecting the patient, so they wear masks, they have all that stuff. There's also another, some hospitals have a system whereby they themselves hire private companies. So they're not nurses working in the hospital, they're nurses that work for the hospital, but outside. They go to the patient's home. So there's no contact. There's really no risk, or not much of a risk of getting anything. If if the nurse doesn't have any contacts with the hospital, she's just coming from her home to the patient's home or to another patient and changing and disinfecting and everything. I don't see the problem, but not for us anyway. So that's another solution to consider.
It's the same in the Netherlands also.
Thank you. Kate, you want to add something?
I want to add something because I can see what you said, Vesna, about separate wards for patients. What I see, what I experience is that there is some discrimination for us when going to hospital. I mean, in my hospital where I get my treatment, there are also patients with thalassemia. So the whole system there is for these patients. I mean, I get into the hospital, they just get my temperature, but they never ask me if I cough, if I've got dyspnea, if I cannot, you know, nothing else. And I'm there and they don't even ask me how you feel. So I think they give a priority to other patients, but not to rare disease patients. My sister told me yesterday she went to hospital and she had a fight with a nurse there, and they put them, the two Gaucher patients, in a separate room. They found at last a separate room for us. So I think this is another thing that we should do. Like Vesna said, we should really ask for that and push them to do that, because I mean, I sit on a chair for 3 hours for the medicine to come, and then I sit for another. So I think, as you already said, there is some discrimination for rare disease patients. We are just put back, you know, and they prioritize.
Yeah.
So I think we should have this in mind. Thank you.
Yeah. We should fight not to be marginalized and put aside. I mean, it's not fair to do that. In Macedonia, they forgot to put rare diseases in vulnerable groups in the COVID-19 situation. So it took me 1 month of going into the media and talking about it and tagging the minister on Facebook so he can see what I'm talking about. And then they made recommendation. It was easy. They just copy paste what we wrote to them. So it's not a difficult job. Usually the patient organizations know what they need. They write it down, they give it to the government. They only need to do it, you know? So we just need to be more persistent and more convincing to tell them that we are here and that we are not moving out and they need to deal with us. That's it. I would like to hear other people's opinions and questions or just comments. I know in Romania there is trouble with home infusion. Maybe Michaela, you want to share something?
Hello. In Romania, it's a little bit weird situation because there are many patients doing their home treatment, home therapy, in fact, but without a legal frame. So if I am a Romanian patient and my physicians agree to do the treatment at home, it's up to me to find a nurse and to pay for it, in fact. It had to be known that some physicians are not agreed to let the patient to do this in home. So there is a discrimination between the patients, because if you have a good doctor, he agrees to do it at home, but others don't. We started in Romania to work on this, but unfortunately we have no support from the referent expert physicians. There are 4 physicians dealing with this at the national level, and about 20 or 30 physicians who are prescribing in every department the treatment for the patients, but the main decisions are made by the national reference, and they noticed us last week. Then they didn't agree to do it at home without clear explanation. So we will work, continue to work, but it will be a little bit more difficult. Last week, at the beginning, this week, in fact, with the National Rare Disease Alliance, we had a reunion, a meeting, and we found, we discussed with many other groups of patients, associations, to work on this home treatment. Hemophilia, Fabry, Pompe disease are interested too. And we just put in place a group to work on this. National authorities were contacted, but they didn't give us yet an answer. So we have to work. We are not considered, for instance. And I would like to know if in Greece, Italy, or other countries, you had physicians against this home therapy project.
Oh, yes.
What worked finally to convince them?
Threatening them is an excellent solution. I've had, there are doctors who are against it, you see. There are regions who are against it, there are doctors who are against it. So what happens is, when I have a problem like this, I have a very nice letter all prepared with all explaining everything and all the benefits and so on and so forth. And I send this letter. Not only do I send it to the treating doctor, he's the last one to get it, but I send it to the president of the region downwards. I send it to the director general of the hospital, and then the health authorities of the hospital, and I explain the importance. And in the end, I also say that if we do not get a positive reply, we may put it in the hands of our lawyers, which we don't have. But I mean, it's a lie, but it usually works, you see. And they don't like that. They don't like the idea of having problems. So I've always managed to get home treatment for patients, except in those two regions where they just don't want to have anything to do with it. But even in regions where it is possible, places where it is possible to have home treatment, there are doctors who are against it. I don't know why. I don't understand it. Because if the patient is stable, he's been on treatment for, I don't know, a year at least, or 2 years, there's no reason why he cannot start home treatment. Because don't forget that the patient, even children, but especially adults, they have their lives and they risk losing their jobs. They have to take holidays and sick leave. And you know, with the crisis today, they really risk losing their jobs. To every 15 days, they're going off to the hospital or something to get their treatment done. So it's important to get together and fight to get home treatment. It's a benefit. I mean, there are companies that can do it without any cost to the hospitals, because if you're taking Cerezyme or Reprieve, they can help you, and it's the best solution. I mean, England, I mean, they have the national health. You have your own national health system, which they send their own nurses home to the patients' homes. We don't even have that in Italy, because they've cut down so much on the public hospitals that they just don't have nurses to send home. So you need the private companies, which don't cost the hospitals anything and don't cost the patients anything. So why deny it? So the thing is, you've got to fight for that. I can try and get you a fact, sort of similar letter, sort of thing that you might be able to use when writing. But you have to write to a lot of people, not just to the doctor. Start with the, head of the region and so on and so forth, and go downwards. and put them all in the letter and see what happens, if this is possible in Romania.
I will retain this that you wrote to many kind of officials of authorities, and we will enlarge the people we will contact. Do you have home infusion, home therapy services now for Pompe patients and Fabry patients from Romania? Asked me to make this question.
Fabry patients have been on treatment for more than 10 years in Italy on home care.
Pompe and
Fabry patients.
And Pompe too?
No, no, because the prescription sheet in the vials says that is in Italy anyway. It says it's not for home. It must be administered in the hospitals. We have 2 patients who are severely affected, who are able to have home therapy, and the Pump Association is fighting. We're fighting with them to allow them to have treatment at home, because it's just very stressful. It's 6 hours of treatment, and some of the patients are so sick that you have an ICU in the child's bedroom. Let's put it this way: you've got to dismantle the ICU, the high intensive care unit in the child's bedroom, load it onto the ambulance, take it to the hospital with the child, put it in the room in the hospital, get him infused for 6 hours, dismantle the whole thing, put it back on the ambulance, and send it back home with the child. This is crazy. This is crazy, because in the United States, pump patients do their treatment at home. And I think in England as well.
In UK too, I think.
In the UK.
Yeah,
and we're working together.
In the UK, we have all patients, so Pompe, Fabry, MPS, Gaucher, and what we normally do is when a patient starts on ERT, they start in hospital, and depending on the different disease, there is a standard protocol. So for Gaucher patients, they have 3 infusions in hospital, and as long as they are okay and they're happy, they then transfer to home care. And there's a different, I think for Pompe it's something like 3 months, and for different diseases it's different times. But yeah, we definitely have a lot of evidence on the benefits of home therapy. And I did actually see somebody on the chat as well, is that if you have your treatment in a UK hospital, the hospital has to pay 20% extra VAT on top of the drug, which means that money is being paid to the hospital administration rather than being used to buy more drug for more patients. So, when you consider the saving in the hospital, you can use that towards some of the home care costs, and then the rest of it can go back in the pot so more patients can have treatment.
Thank you.
Okay, thank you for this, for sharing and for discussing it. I just wrote a message in chat so that all of you can email Joe, like just send a message, because this is how we are going to have all of your emails and send you the link from the recording from this meeting. I hope you were aware that it's recording. It says up here recording, because it's a public webinar for IGA members and people who wanted to be here. So this will be shared with us, and also we are going to send you some documents, some slides, some helpful stuff that you can use in your own countries to fight. But have in mind that each country is different, each administration and government is difficult, and you need to try different kind of approaches to get them to change something that you need. So don't give up ever. Try everything you can think of. And I hope that this kind of webinars with sharing experiences helps you in getting new ideas about what to do when you want to change something in your government. So, anything more that we want to say? Anyone else? I see people talking about drug shortages. I'm also in a group in. I don't think there are drug shortages at this point. I'm in a group in Eurordis, the DITA task force, and we are following countries and seeing if there are drug shortages anywhere. And also, as IGA, we got letters from all of the pharmaceutical companies saying that they have no problems in drug production or drug distribution. So don't worry about that. It won't happen to us. We are going to have our drugs. No problem here. Yeah, we are safe in that. Okay. Okay, I'm just reading if I've missed some questions or something. I really hope that this was helpful, and we are going to try to have more webinars like this to share experience on different subjects, on different issues that are important to us as patients and patient advocates and families. And we are going to try to be more communicative if you would like to, of course. As long as we have people attending, it's okay. Otherwise, no. So if there is nothing more,
I would like just to make another question for who pays the home therapy service now in Italy and in Greece or in other countries?
Nobody.
National insurance, health insurance, or private companies, or the pharma industry through associations?
Concerning Italy, you're talking about home therapy, home
yes,
treatment.
Home services
home treatment.
for
yeah,
home
service.
yes.
Okay, there are two companies at the moment. One was hired by Sanofi Genzyme, and the other is the one that started the whole thing 10 years ago. It was caregiving for Shire. Now it's called NHG Group or something like that. They are paid by Shire and Genzyme. They pay for the home treatment. So what happens is these agencies come to your house, they infuse you with no cost to the hospitals and no cost to the patient. And that's the way it works here with the private care. With the public care, which doesn't work, I mean, it may work in one or two patients in each region. It is the hospital that has a contract with a private agency. So the hospital pays, but the patient doesn't pay for that. And the thing is, they only give it out to severely ill patients, like, I don't know, bedridden patients who cannot be moved. And even in that case, it's very difficult to obtain. I have some MPS patients who are doing this kind of treatment with these special nurses that are hired by the hospitals. And but these are patients on wheelchairs and this sort of thing. Oh, and I have one Gaucher patient. She's a type 3 patient, and she's doing it at home with this kind of public service. But the patient doesn't pay anything. It's either the hospital that has a contract with a private company and pays for it, the hospital, not the patient, or it's Genzyme and what's his name, and then Shire that have two companies. They pay the companies to do the home infusion for the patients with no cost to the hospitals or to the patient. That's how it works here.
I want to have another question for Fernanda. I mean, in the blue box of the medicine, in Greece, it's written that it's only for hospital use. how did the countries that have home therapy change that?
The companies changed it because in the beginning, for example, let's go back to Cerezyme. When Cerezyme was made in 1995, I think, I don't remember anymore, they changed the medical sheet inside, and they made it that it could be used outside of the hospital. For example, in the case of Pompe's disease, they don't have that. It has to be taken in the hospital, and it's not easy to change that. You have to go to the drug
organization, right?
And it's a long procedure, and the company has to do it. Doesn't depend. I mean, the patients are trying, but basically, it's the company that has to lobby for this with the drug agency, which is, you know, it's a problem. So for the products that Shire has and Genzyme has, these drugs can be administered at home, but Viprev cannot be given to type 3 patients at home.
Yes, yes.
Because on their sheet of paper,
there's some restrictions, right?
It's written, yes, it's under restriction. So the patient has to switch from Viprev to Cerezyme in order to have home therapy.
Okay, so now we can continue. Andretta, you wanted to say something?
Yes, I wanted to follow up on this, what Kate and Fern were talking about just a minute ago. So in Denmark, all treatments for Gaucher is hospital treatments. And at the same time, we've had the access to home treatment. This means that we will have to go to the hospital to get our drug if we want to have home treatment. So even though there are set up now different possibilities, so that you can make an agreement with the hospital that they send you, there are companies who's working on this, so that they can send you everything you need, from needles and syringes and the medicine and water and everything. So it will be delivered by this company at a set time that you agree with the company. So you store it at home, but it's hospital treatment. If you take the medicine out of the hospital and you get a prescription from your hospital doctor, the price will raise from a private pharmacy with, I don't know, 2 or 3 times. It's really hysterical. So it is a hospital treatment, and only hospital doctors from specialist centers can prescribe this. So even though we do have the access to home treatment. So it's just to say it's, yeah, it's different. Okay.
Thank you.
Vesna, I was just going to add to the conversation that Fern and Kate had, is that the little piece of leaflet in each of the vial, the box, is where it basically says about home treatment. And I remember, you know, the IGA working with Genzyme at the time to help support change their the leaflet, which is called the SMPC. So I think that that's a point that maybe we can pick up as well as part of going forward, is to try and understand from the company's position, if they have if in the label they have that they can have home treatment, is that in the label across the whole globe, or is that regional? So I think that that's maybe something that we can also try and address as part of working. I would suggest, you know, starting through the EWGGD.
So a comment on this, I think it's if EMA approves the treatment for Gaucher and they approve it from home therapy, then each national authority of each country is approving the drug again. So each country in Europe is saying, okay, we are approving this for Gaucher, but then they have to decide if they will approve it for home therapy or not. Like in North Macedonia, you just need to register the drug as a home therapy drug, and but even if it's registered, the doctors need to allow you to get it at home. You cannot get it even if it's registered like that. So in many countries, this is different. It depends on the agencies, on the ministries of health, health authorities, and of course, it depends on the doctors. Because at the end, those are the people taking the responsibility for the patient. If the patient is at the hospital or the patient is at home, the doctor takes the responsibility of the patient taking the drug. So if something happens, it's not the nurse's fault, it's the doctor's fault at the end.
Yes and no, because it depends on the company. Because, for example, with Sanofi's drug, it's the doctor of the reference center who's supposed to be on hand.
Yeah.
With the other company, no, they have their own doctor who is responsible. I mean, the doctor will allow a doctor of a patient on Vipri, for example. He decides this patient can do home therapy. He says, okay. But it's actually who is responsible if something goes wrong is the doctor that works with the home care unit, you know?
Okay. Yeah.
Whereas with Cerezyme, with Genzyme, I'm sorry, I got the name wrong. With Genzyme, it's supposed to be the doctor from the reference center who is on hand. And I mean, how's the doctor from the reference center going to be on hand for so many patients? He won't remember which patient is doing this infusion, this sort of thing. No, it's not good.
Fernanda, sorry, but I beg to differ with you on that. The only one who is responsible for the treatment of with enzyme therapy at home or in the hospital is your caring physician, the one who is treating you, and not someone at Sanofi.
No. In fact, Sanofi doesn't take any responsibility for that. No. What I was saying is that, of course, the patient needs the authorization from the specialist of the reference center in order to do home therapy. Okay, but it depends on the companies. One of these companies has the doctor who is also responsible. If something happens during the infusion, the nurse will phone the doctor who is immediately there. I mean, whereas Sanofi doesn't have this situation. If something goes wrong, theoretically, the nurse phones the doctor of the reference center, hoping to be able to find him, and to let him know that something's gone wrong. See,
but that is dependent on that is different in each country. In our country, it's your physician who's being called, but I can understand that it's different in another country.
Yeah, like here we have Paulina from Mexico saying that the responsibility is in the institution authority. So even if the doctor recommends it, the institution won't allow it. So it will not happen. It's a lot of politics. So we need to learn how to be political also and diplomatic with all of the doctors and the institutions. Something we need to learn, more or less. This was a great discussion.
Very difficult.
Oh, it's never easy.
Well, sometimes you are diplomatic. Sometimes you have to go and be the bad guy of the film.
Yeah, take a punch.
Yeah, because when you are trying to save a life, or sometimes you have to say what you think.
Yeah. Yes. It is like that. You're right. Yeah. I want to thank all of you because you are wonderful people and we've had a wonderful discussion here. It made my day because it's boring being in quarantine and isolated, and this kind of conversation make you feel more alive.
Makes you feel human, right?
It's good. It's definitely good. So soon we are going to have our BNL meeting like this on a Zoom call. It would be interesting. I hope to see you all of you over there. It's important that we get together and go through all the IGA documentation and reports, and of course learn something new again and discuss things. It's very important to stay together and go through all these difficult situations as an alliance, as a group of people who want to make a difference in this world.
When is it? I don't remember. When is the meeting?
I'm not wrong, 23rd.
It's the 11th and 12th of October. Oh, sorry for the. I thought you meant for Leiden.
I'm sorry.
The IGA.
It's the 23rd of May.
Oh, I remembered May. Okay.
8:00 p.m. Central European time. Yeah.
Good evening.
And in October, we really hope that we can fly to Netherlands and have a face-to-face meeting.
That would be good.
I think all of you miss flying a little bit.
Yes.
Okay, so you have email from Joe also about the BNL meeting, a newsletter, and also a proxy to agree that you will attend the meeting. So please send that, and let's get together again.
Okay.
Okay. So I will say goodbye now, and I hope to see you again. And also there is a message from Alice from Albania. He says that today he is doing his therapy and he's doing it at home, and he can record it and post the procedure to us, which would be very nice to see how somebody does home therapy. Thank you, Alice. That would be great. Yeah, send it to Joe and then we can share it with the people. Excellent. Thank you all of you for your effort and your attention, and see you soon. Bye.
Bye.
Bye. Bye, everybody.
Bye.
Take
Bye.
care.
Thank
Take care,
you.
Tanya.
Bye.
Bye.
Bye bye.
Bye.
Bye. Bye.